Assalamualaikum beta. In this video lecture, I will deliver the lecture on disorders of pigmentation and melanocytes. Okay. The very first lecture I delivered in pathology was blistering disorders of the skin. Okay, this is lecture number 2. Before I start this lecture, I must mention that this complete lecture is from your textbook, Robbins Spaces. Okay. So let's start with this topic, disorders of pigmentation and melanocytes. Beta, before I really get into this topic, let me recap few things from your basic knowledge. Okay, you can now see. Let me beta clearly. Okay, like this. Yeah, can you see beta these two components of skin? This at the top is, yeah, from here till here is epidermis, and then below is dermis. Okay, right. And can you see the part of the epidermis coming down into the dermis, these little projections coming into the dermis? What are these called? Retirages. I hope you are very much clear to this because this is very basic. Retirages. And can you see these structures going into epidermis? These are dermal papilla. Okay, these are dermal papilla. Okay, the part of the dermis papillating out, this is called dermal papilla. Yeah. And this entire is epidermis. This entire is epidermis. Okay, can you see the layers in epidermis? This top layer is, from here to here is stratum corneum, then here to here is stratum lucidum, and here to here is stratum granulosum, then from here to here is stratum spinosum, and then is stratum basale. This entire layer, even the cells in the stratum basale, few are going inside into retirages. Okay, this is stratum basale or basal layer. Did you notice one thing, beta? That the cells throughout are same. In the stratum corneum, all these cells are keratinocytes or squamous cells. Okay, these are keratinocytes, squamous cells. In stratum granulosum, these are keratinocytes, or I say squamous cells. These are keratinocytes or squamous cells. Even in the stratum basale, some red cells are there. These are keratinocytes. These are keratinocytes, also called squamous cells. But did you notice that in stratum basale, with these keratinocytes, there are some green colored cells? They are different. Okay, they are different. They are not keratinocytes. All these red colored cells, they are keratinocytes. Okay, or I should say squamous cells. But these few cells in the stratum basale with this green color, these are not keratinocytes. Okay, these are what? These are melanocytes. Okay, let me take this one melanocyte out here. Yeah, can you see this melanocyte? Okay, one melanocyte. Okay, here this is melanocyte. I have taken it out, and melanocytes were actually present in what layer? Out of all these layers, everywhere there are keratinocytes only, but in stratum basale there are, you can see with this green color, these are melanocytes. Okay, so melanocytes are the cells which are interspersed with keratinocytes in only stratum basale. So melanocytes are only present in stratum basale. Okay, now you see this melanocyte, I have taken it out from the basal layer, and can you see what is happening inside this melanocyte, beta? On the surface of this melanocyte, there is a receptor called melanocortin receptor 1, which is obviously encoded by a specific gene. इसका obviously एक specific gene होगा जो कि कोड करता है इस receptor को, melanocortin receptor 1. By the way, this is a receptor on the surface of melanocyte. Beta, what happens when to this receptor मेलानोकॉर्टिन बाइंड्स? जब इस रिसेप्टर पे मेलानोकॉर्टिन बाइंड करता है तो क्या होता है? सेल के अंदर एक अमीनो एसिड है टायरोसिन, वो कन्वर्ट हो जाता है मेलानिन में. ओके, एंड लेट मी टेल यू बेटा दैट this melanin is, yes, of course it is produced inside melanocyte, but it is not stored here. This melanin is released from melanocytes, and it is released, it is stored here in keratinocytes. Okay, so if I take you here back to this picture, that this green colored is melanocyte, and inside this melanocyte tyrosine is converted into melanin, And by the way, melanin, yes, it is produced in this melanocyte, but it is not stored in melanocyte. It is stored in these red colored cells. What are these red colored cells? These are keratinocytes, okay? So melanin is produced in melanocyte and it is stored in, yeah, these red colored cells which are keratinocytes. Okay, can you see this keratinocyte where melanin is stored? Okay, and when the melanin is stored in keratinocytes obviously they become pigmented. ठीक है, अगर ये मेलानिन स्टोर्ड ज़्यादा है तो फिर ज़ाहिर है बेटा स्किन ज़्यादा पिगमेंटेड होगी, और अगर मेलानिन स्टोर कम है तो मेलानिन स्टोर कम होने से स्किन कम पिगमेंटेड होगी. ठीक है, ज़्यादा पिगमेंटेड स्किन ऑब्वियसली डार्कर स्किन होगी और कम पिगमेंटेड स्किन ज़ाहिर है लाइट कलर्ड स्किन होगी. ठीक है, ओके. And obviously, beta, let me tell you that due to exposure to sunlight, melanin production is increased in the melanocytes, okay? And this increased melanin, obviously, it protects your skin from harmful effects of sunlight. You just think about it. If let's suppose due to any reason, melanin production is decreased, so sunlight can produce some serious effects on your skin, by the way, okay? Only in cases if melanin production is decreased due to whatever reasons. There may be some problem in conversion of tyrosine to melanin. There may be some problem with this receptor. There may be some problem with the transfer of melanin to transfer of melanin from melanocyte to keratinocyte. Any problem in melanin production or transport. So due to whatever reason melanin production is decreased, sunlight can produce some harmful effects to on your skin. Okay, so yeah, this is the concept you need to have better. Now let me get you to disorders, pigmentation disorders. Okay, pigmentation disorders, especially like at number 1 I will discuss freckles. But let me tell you one very important thing before I take you to freckles, to have a better concept of freckles later. That, yeah, three things can happen. Okay, now you have to understand three things to have better concept of number 1 pigmentation disorder of skin, that is freckle, which I'll discuss obviously. Those three things you need to have in your mind are, number 1, if let's suppose here melanin production is very much increased, okay, this can be the possibility. By the way, pigmentation disorders which I will discuss about in this video, I will talk about freckles, lentigo and melanocytic nevus. Okay, these are the three pigmentation disorders which I'll surely talk about in this video. And in all these pigmentation disorders of skin, melanin production is increased. Okay, specifically in freckles, what happens, that there may be three things. Okay, that production of melanin is increased from tyrosine, or the transfer of melanin to keratinocytes is increased, or at number 3 there is some kind of mutation in this receptor, mutation, gain of function mutation. When there is gain of function mutation in this receptor, what will happen, even a little amount of melanocortin can trigger this conversion and increased production of melanin. Okay, three things we discussed. Yeah, you need to understand these three things बेटा. एक तो ये है कि मेलानिन की प्रोडक्शन जो है वो बहुत ज़्यादा हो जाए. दूसरा ये है कि मेलानिन का जो ट्रांसफ़र है फ्रॉम मेलानोसाइट टू केराटिनोसाइट वो बहुत ज़्यादा हो जाए. थर्ड थिंग इज़ जो मेलानोकॉर्टिन रिसेप्टर 1 है, जो उसका जीन है, उसमें गेन ऑफ फंक्शन म्यूटेशन हो जाए, जिसकी वजह से रिसेप्टर जो है ओवर एक्टिव हो जाएगा और मेलानिन प्रोडक्शन बढ़ जाएगी. ठीक है, इन तीनों में से कोई भी चीज़ हो आप कंसीडर करें, तीनों केसेस में मेलानिन की जो क्वांटिटी है वो इंक्रीज़ होगी. और जब मेलानिन की क्वांटिटी इंक्रीज़ होगी, ख़ास करके जब आप सन में एक्सपोज होगे, तो जब आपकी स्किन पे सन पड़ेगा, सनलाइट पड़ेगी, तो ये तो मेलानिन प्रोडक्शन और बढ़ जाएगी. एक तो इन तीन चीज़ों की वजह से कि मेलानिन प्रोडक्शन यूजुअली इंक्रीज़ हो रही है ड्यू टू सम अननोन रीज़न, मेलानिन का ट्रांसफ़र ज़्यादा हो रहा है, मेलानिन का जो रिसेप्टर है उसमें म्यूटेशन हो गई है, मेलानोकॉर्टिन के रिसेप्टर में कुछ म्यूटेशन हो गई है, जिसकी वजह से अल्टीमेटली डाउन स्ट्रीम पाथवेज बढ़ गए हैं और ये कन्वर्जन जो है बहुत बढ़ गई है टायरोसिन टू मेलानिन. So due to all these three reasons, melanin production is increased. Yeah, and additionally, when you are exposed to sunlight also increase melanin production. So these three factors plus when you are exposed to sun, then what happens? Some lesions appear on your skin due to this increased melanin, and those lesions which are produced due to this increased melanin are like small spots on your skin, small macules on your skin. Okay, those macules are called freckles. Okay. Yeah, now you are clear with the basic beta. Now I will get you to the very first pigmentation disorder of the skin, that is freckles. Yeah, now you see freckles. Freckles, they are most common pigmented disorder of your skin, and by the way, most common in childhood and especially in lightly pigmented individuals. Okay, who are fair skinned individuals. Okay, खास करके बच्चों में होती है और जो फेयर स्किन्ड बच्चे होते हैं उनमें. ठीक है, तीन मैकेनिज्म मैंने डिस्कस किए. या तो पिगमेंट प्रोडक्शन इंक्रीज हो जाए मेलानोसाइट में, यानी कि मेलानिन की प्रोडक्शन बहुत ज़्यादा हो जाए, या तो देर इज़ इन्हांस्ड मेलानिन ट्रांसफ़र टू एडजेसेंट केराटिनोसाइट्स, और म्यूटेशन इन्वॉल्विंग melanocortin receptor 1 gene. Any of these three things, 1 2 3, any of these three things, or even combination of these three things, what will happen? Melanin will be increased and there will be hyperpigmented spots on the skin. And I must mention this very important point, beta, that melanocytes produce extra melanin to protect skin from sun damage. Therefore the lesion of freckles tend to appear after sun exposure. ठीक है, इन तीनों चीज़ों की वजह से क्या हो रहा है? मेलानिन ज़्यादा बन रहा है, और ऊपर से जब आप सनलाइट में खुद को एक्सपोज करेंगे तो सनलाइट की वजह से और ज़्यादा मेलानिन बनेगा, और आपकी स्किन पे उस ज़्यादा मेलानिन की वजह से हाइपर पिगमेंटेड स्पॉट बनेंगे कुछ इस तरीके के, और उसको हम फ्रेकल्स कहते हैं. ठीक है, कैन यू सी दिस? या कैन यू सी दिस? And these lesions really fade when look, when you sit in AC room, yeah, comfortably, there is no sunlight, these freckles fade. And when you get out in the sunlight, and when your skin is exposed to sunlight, these spots, these macules, they get darker. What's the reason? When you are sitting in an AC room comfortably where there is no sunlight, these are faded, right? And when you get out in the sun, they become very much dark like this. What's the reason? When you are, look beta, when you are sitting in AC room, there is no sun, so there is increased melanin production, obviously due to these three mechanisms. But because there is no sun factor, so there is no extra melanin production which was due to sun. And when you are out in sunlight, then these three mechanisms participate in melanin production. Plus there is extra melanin production which is due to exposure to sun. So in this case freckles appear on the skin. Yeah, and in this case freckles fade. Yeah, are you clear with this? Okay, let me get you to more concepts related to freckles. Okay, especially in case of neurofibromatosis, it's a condition. Some spots appear on the skin called cafe outlet spots. And these spots are, by the way, very much similar to freckles histologically, but there are difference between the cafe outlet spot and freckles. These are freckles, okay, and they become very much prominent when you are exposed to sunlight. Then what's the difference between cafe outlet spot and these freckles? Cafe outlet spots, by the way, are seen in a condition called neurofibromatosis. Okay, cafe outlet spots are very much similar to freckles, but let me tell you the difference. That the difference is the lesion in case of cafe outlet spot is little larger. Can you see? This is cafe outlet spot. Isn't it larger than freckle? It is larger than freckle. And by the way, it appears independent of sun exposure. Okay, the lesion of the freckles I mentioned you, when you are exposed to sunlight, the freckles, the macules become very much prominent. Okay, but these are cafe outlet spots. They are very much similar to freckles. Okay, but the difference is they are little larger. They appear independently without any exposure to sunlight. And by the way, when you look at the histology of this lesion, you will see the epidermis having melanocytes filled with lots of melanin in the form of melanosomes, that are melanin bodies. Okay, yeah. Now let's have a look at the morphology of freckles. The lesion of freckle, which is pretty much like yeah, let me show you quickly again the same picture which I showed you. These are the freckles again. Okay, these are the freckles. These are small, just 1 millimeter, tan red or light brown. These are macules. Okay, macules are smaller, but the patch is large. freckles में patch नहीं बनता, फ्रेकल्स में मैक्यूल बनता है, छोटा वाला. ओके, ये पैच बनता है आपके कैफे आउटलेट स्पॉट में. बाय द वे, फ्रेकल्स आर tan red or light brown मैक्यूल्स. ओके, they appear after the sun exposure because sun increases extra melanin production, and they fade during winter. क्योंकि विंटर में सन इतना कम होता है जिसकी वजह से ये फेड हो जाते हैं. बट दे डार्कन in summer, because in summer the sun is at sun is really hot. So in summer, because of increased sunlight, these freckles become darkened. Okay, not because of increase in number of melanocytes. The number of melanocytes is normal, but there is increase in degree of pigmentation. Increased size of the melanocytes may be increased, but the number of the melanocytes is normal. So melanin production is increased from melanocytes. Melanin production can be increased from melanocytes, but the number of the melanocytes is normal. Okay, there may be hypertrophy of the melanocytes, but there is no hyperplasia. Okay, this is all about beta freckles. Yeah. Okay, after freckle is another condition of another pigmentation disorder of skin, that is lentigo. It is a common benign localized hyperplasia of melanocytes. क्या freckles में melanocytes की hyperplasia हो रही थी? No. Melanocytes were like, maybe there was hypertrophy, increased melanin production, but in case of freckles, melanocytes का number normal था. In case of lentigo, there is increased in number of melanocytes, that is hyperplasia. Okay, freckles were really common in children. Lentigo are more common in, they can occur in all the ages. They are initiated mostly in infancy and childhood, by the way. The pathogenesis is not clear. Why there is hyperplasia of melanocytes? You are not really well known about that. But there is just hyperplasia of melanocytes. That is, the number of the melanocytes is increased. Okay. If you look at the morphology, that again, let me quickly tell you a little about this. That if, let's suppose this is a melanocyte, and in case of lentigo, what happens? There are so many melanocytes, so they produce, because there are so many melanocytes, they produce lots of melanin. तो ज़्यादा melanin के बनने की वजह से क्या होगा? melanin डार्क कलर देता है स्किन को, तो स्किन पे एक हाइपर पिगमेंटेड पैच बन जाएगा. एक हाइपर पिगमेंटेड, एक नहीं, ऑब्वियसली बहुत सारे हाइपर पिगमेंटेड पैचेस बन जाएंगे. ये हाइपर पिगमेंटेड पैचेस क्यों बन रहे हैं? मेलानिन प्रोडक्शन ज़्यादा होने की वजह से. एंड इन केस ऑफ लेंटाइगो, द मेलानिन प्रोडक्शन इज इंक्रीज ड्यू टू इंक्रीज इन नंबर ऑफ मेलानोसाइट्स. ओके, so yeah, this is the case, and they can appear on the skin, they can appear on the mucosa as well, by the way. If I show you the lesion beta, we can see here, can you see lentigo? Aren't they a little larger than freckles? They are larger than freckles. Freckles were really small. Freckles were, if I'm not wrong, they were just 1 millimeter. And they are, the lentigo are 5 to 10 millimeter. They are oval. They are tan brown macules or patches. Tan brown macules or patches. Macules little smaller, patches little larger, but mostly you come to see these are patches. And if you even compare this with freckles were really small. They were all macules. But these lentigo, they are not all macules. They are mostly patches and few are macules. So they are little larger, by the way. Okay. And also they are, not dependent on sunlight. They do not darken when exposed to sunlight. They appear same, if you are exposed to sun, if you are not exposed to sun, you are sitting comfortably in AC room, or if you are out in sun, they do not darken, they remain same. And if you remember, in case of freckles, the lesion was getting darker when you were getting out in the sun, and when you are sitting comfortably in the AC room, the freckles used to fade. Okay, this is the difference between lentigo. So far, how many differences we discussed in freckles and lentigo? The one difference is, in case of freckles, the number of the melanocytes is normal. Okay, the only thing is, in case of freckles, that melanocytes were increased in size and their melanin production was increased. But in case of lentigo, there is hyperplasia of melanocytes. Okay, this is the difference number one. Number two difference is that in case of freckles, the lesions used to get darken when you were out in the sun. But in case of lentigo, the lesion used to be same when you are out in sun or you are sitting comfortably in the AC room. Okay. And one more difference is, in case of freckles, they were mostly macules, which were small, up to only, I guess, 1 millimeter. But in case of lentigo, they are 5 to 10 millimeter. They are small, by the way, but as compared to freckles, they are little larger, right? If you have a look at the histological features of lentigo, then you will see, obviously, melanocytes are hyperplastic, so they are multiplying. Their number is increased in the linear fashion, non-nested fashion. This is the nested fashion normally in the form of nest. This is nested fashion. But in case of lentigo, the melanocytes do not multiply in this nested fashion. However, they grow in this fashion, okay, linear fashion, non-nested fashion. This is non-nested linear melanocytic hyperplasia and restricted immediately above the basement membrane. Why immediately above the basement membrane? Because obviously melanocytes are produced in the basal layer, and basal layer is just above the basement membrane, okay? And they produce the hyperpigmented basal cell layer. Obviously basal cell layer में अगर melanocyte hyperplasia करेंगे तो it will be producing hyperpigmented basal cell layer also. Okay. The term lentigo refers to similar cellular proliferation as in lentigus nevi and in certain melanoma. You know what, बेटा, जिस तरीके की लीनियर नॉन नेस्टेड मेलानोसिटिक हाइपरप्लेजिया हो रही है आपके लेंटाइगो में, इस तरीके की सेम इसी पैटर्न में हाइपरप्लेजिया होती है इन केस ऑफ लेंटिगस नेवाई एंड इन केस ऑफ मेलानोमास. वहाँ पे उनको हम बाय द वे एक्रल लेंटिजनस मेलानोमा भी कहते हैं. ठीक है, यू विल बेटर अंडरस्टैंड दिस टर्म्स व्हेन यू आर व्हेन यू विल बी डूइंग दिस टॉपिक्स. बट फॉर नाउ यू जस्ट कीप इन योर माइंड that this type of proliferation of cells, linear non-nested, which you are looking in case of lentigo, the same sort of proliferation you will come to see in some other lesions like lentiginous nevi and melanoma, and those are also termed as, these lentiginous nevi and melanoma, acral lentiginous melanoma. Okay. Yeah, that's okay. That's the thing. And also histologically, you will see in case of lentigo, there is elongation and thinning of rete ridges. Why there is elongation and thinning of the rete ridges? Because if I draw here, if let's consider all the 4 to 5 layers of epidermis, 1, 2, 3, 4. This is the basal layer, okay? And in basal layer, there are melanocytes, okay? These are melanocytes. Normally, rete ridges used to be like this, yeah? And there are melanocytes. What happens in lentigo? These melanocytes will be hyperplastic, so they will multiply this way down into rete ridges, and they will try to further elongate. Melanocytes are here, and they are now hyperplastic, so they are multiplying. So they will keep on growing down, and they will take these rete ridges further down, elongating them and tapering them. Okay, so these are few features of beta lentigo. Hope you are clear with lentigo as well. Okay. At number 3 is melanocytic nevus, which is also called pigmented nevus. Yeah, melanocytic nevus, also called pigmented nevus, beta. They are also known as moles. Moles on your skin. Okay. Don't forget, this is a benign neoplasm. Yeah. This is benign. Complete benign condition. Complete. It doesn't have potential to grow into malignancy. This is complete benign neoplasm, okay? There may be acquired mutations maybe inherited mutations, but most common are acquired mutations. Okay, mutations in what thing? I will talk about that in the pathogenesis part for sure. Okay, let me quickly tell you that what happens is, okay, yeah, let me here explain you quickly the pathogenesis of what thing? Melanocytic nevus. What happens is, beta, there is actually NRAS pathway. I will not completely, obviously, it requires a separate lecture to discuss about this pathway. But in short, I will tell you that NRAS is the main entity, and there is a downstream pathway of so many molecules, and in the end, what do is they increase growth and proliferation of melanocytes. Okay, राइट एनरास के डाउन स्ट्रीम पाथवे में बहुत सारे मालिक्यूल आते हैं, एक और कंपोनेंट बनता है, फिर एक और बनता है, फिर एक और बनता है, एंड फाइनली देयर इज ग्रोथ एंड प्रोलिफरेशन ऑफ melanocytes. Okay, and one downstream pathway that I need to mention is BRAF pathway, serine threonine kinase BRAF. Okay, this is a downstream pathway. बेटा अगर इसमें या इसमें एक्टिवेटिंग म्यूटेशन हो जाए, एक्टिवेटिंग म्यूटेशन कहें या फिर आप गेन ऑफ फंक्शन म्यूटेशन कहें, तो क्या होगा बेटा? दिस पाथवे विल बी जस्ट प्लस प्लस प्लस. दिस पाथवे विल बी enhanced, increased. This pathway will be over activated, and there will ultimately be increased growth and proliferation of melanocytes. Okay, when there is increased growth and proliferation of melanocytes, obviously there will be increased number of melanocytes. Okay, yeah. The question here that should be coming into your mind is two questions, by the way, should be here. If there is increased number of melanocytes due to this thing, due to this reason, activating mutations in either this gene or in this downstream pathway, melanocytes are now increased very much. So two things that should be now in your mind. Two questions. Number one, when there is increased melanocyte, what's going to happen with his skin? What type of lesion will appear? Okay, melanocytes are increased. So what's going to happen with your skin? Okay, this should be the question. Na? Number two question is, why it does not develop into melanoma? Melanoma is a malignant condition. If it is growing and proliferating in this fashion and melanocytes are increasing in some crazy fashion, then why the heck is it not developing into melanoma? Why? If it is growing and proliferating, lots of melanocytes are being produced. At one stage it is melanocytic nevus. And why it is not converting into melanoma? Let me tell you. Let me answer the both questions. Yeah. If lots of melanocytes are produced, so what happens to your skin? Onto your skin, macule can appear, or even a patch can appear, or even a nodule can appear. How do you define? Then how you come to say macule will appear, patch will appear, or nodule will appear? Okay, let me tell you. Look, this is the epidermis. Okay, this is the dermis. This is the basal layer, okay, of the epidermis, and here are melanocytes. In this case, melanocytes are proliferated very much, and they are very much proliferative, so they can even come down into the epidermis. तो बेटा मेलानोसाइट जब प्रोलिफरेट करेंगे और प्रोलिफरेट करने के बाद जितना वो ऊपर होंगे ना एपिडर्मिस में या इवन अपर पार्ट ऑफ डर्मिस में, तो लेयन स्किन के ऊपर उतना फ्लैट होगा, और जितना ये मेलानोसाइट स्प्रेड करके प्रोलिफरेट करके नीचे आते जाएंगे, यहाँ से ऊपर से नीचे प्रोलिफरेट करते करते नीचे आएंगे, तो लेयन उतना ज़्यादा प्रोमिनेंट होता जाएगा. सो melanocytes, when they are proliferating and they are now still in the epidermis or upper part of the dermis, the lesion will be flat like macule or patch. But when they are very much proliferative, they will come down into these deeper dermis. The lesion will become more prominent like a nodule. Okay, so you are clear with this question? Now the question is, why not melanoma if it is growing and proliferating continuously? So it can later develop, it should develop into melanoma, na? Why not? Let me tell you that Okay, you know what, beta? This growth and proliferation of the melanocyte is for limited period of time. The later this growth and proliferation of the melanocytes stops. That's the reason this melanocytic nevus does not develop into melanoma. Look, what is happening? Again, let me tell you here. या तो NRAS में या तो ब्राफ पाथवे में गेन ऑफ फंक्शन म्यूटेशन हो गई है, ठीक है, जिसकी वजह से मेलानोसाइट बहुत बढ़ गए हैं और उनकी वजह से स्किन पे लेजेंस भी अपीयर हो रहे हैं और इसको हम मोल कहते हैं या फिर मेलानोसिटिक नेवस कहते हैं। ये बिनाइन कंडीशन है। अगर ये बेटा इसी तरीके से ग्रोथ प्रोलिफरेशन करता रहे तो इसको मेलानोमा में डेवलप होना चाहिए है ना, लेकिन ये मेलानोमा में डेवलप नहीं हो रहा। क्यों? क्योंकि ये एन रास और ब्राफ की वजह से इसमें गेन ऑफ फंक्शन म्यूटेशन की वजह से जो ग्रोथ और प्रोलिफरेशन हो रही थी वो एक लिमिटेड टाइम की वजह से होती, लिमिटेड टाइम तक होती है, उसके बाद मेलानोसाइट की प्रोलिफरेशन नहीं होती। क्यों नहीं होती? द रीज़न इज़ activation of some other genes like P16 and INK4A. These two are potent inhibitors of cyclin dependent kinase 4 and 6. ओके, तो P16 और INK4A आते हैं जो कि साइक्लिन डिपेंडेंट काइनेस 4 और 6 को बंद कर देते हैं, और जब ये साइक्लिन डिपेंडेंट काइनेस 4-6 बंद हो जाएगा तो मेलानोसाइट की प्रोलिफरेशन और ग्रोथ रुक जाएगी, ठीक है, क्योंकि ये ग्रोथ प्रोमोटर है, ठीक है। सो व्हाट विल हैपन ड्यू टू म्यूटेशन इन NRAS and BRAF gene, there will be increased growth and proliferation of melanocytes. Okay, they will keep on growing and there will be formation of what? Melanocytic nevus on the skin, that is mole. And the question that why they are not developing into melanoma is, after a certain period of time, the growth and proliferation of the melanocytes is stopped. Why? Because of these couple of entities, these two molecules, P16 and INK4A. They inhibit cyclin-dependent kinase 4 and 6. When this nice little body is decreased, there will be nothing to promote the growth of these melanocytes, and this is the reason the melanocytic nevus does not develop into melanoma. Okay, you clear with this concept? Right. Now let me take you to the morphology of the melanocytic nevus. Morphology of melanocytic nevus, okay? Yeah. Lesions, which I told you, they may be flat macules, patches or elevated papules. Elevated papules or even nodules you can write here. And it depends on what? Depends on, how deeper the melanocytes have gone, okay? The lesion which appears on the skin tend to brown. They are uniformly pigmented, less than 6 millimeter. They become more prominent during pregnancy due to hormonal surges, sensitization. Okay. Now comes the important part of the morphology. That is morphological changes over time. And I need to attach picture with this here, okay? So you can follow both the things. Yeah. Okay. Now from this picture it will be very easy. Can you see better? Two things here. This part is dermis, and this right here, this part is epidermis, okay? And this is the basal layer, okay? This is the basal layer, nice little. And in basal layer, can you see few melanocytes? They are looking very normal. This is the picture of normal skin. This is dermis, very much happy, having nice little life. This is epidermis, very much happy, having a good life. And this is the basal layer, okay? And in basal, yeah, you can see few melanocytes. Okay, this is normal skin. But in case of melanocytic nevus, you know now what happens? These melanocytes proliferate. Okay. Now can you see melanocytes proliferating? Can you see melanocytes are proliferating? But the thing is the melanocytes are restricted to dermoepidermal junction. Okay. They are restricted to dermoepidermal junction. This stage of the melanocytic nevus is called junctional nevi. Read here. Junctional nevi is the earliest lesion consist of aggregates or nests of the round melanocytes that grow along the dermoepidermal junction. This stage of the melanocytic nevus, when the melanocytes are restricted to the dermoepidermal junction, this stage is called junctional nevus. Okay, and their cell nuclei is very much uniform, round, and having little or no mitotic activity. Okay, but this is the junctional nevus, and when these cells grow down further, you can see they are restricted to dermoepidermal junction, and few cells have gone into dermis as well. Okay, when these cells proliferate and further go down into deeper dermis as well, then this is not called junctional nevus anymore. This is now called compound nevus. Yeah, this is now called compound nevus. Okay, and when these melanocytes are proliferating and they are completely detached from the dermoepidermal junction and they are completely in the dermis, they are completely in the dermis, and they are now called intradermal nevi. Okay, they are oldest layer obviously as compared to junctional nevus. Compound nevus, these dermal nevus are obviously little older. And yeah, this is called intradermal nevus. Okay, because this is completely in the dermis. Okay. अच्छा, अब जरा नोट करें एक चीज़ इन तीनों में से कि ये जंक्शनल नेवस है, ये कंपाउंड है, ये डर्मल नेवस है. इसमें जो मेलानोसाइट्स हैं ऊपर हैं, इसमें कुछ नीचे आ गए, इसमें बहुत नीचे आ गए. जो स्किन पे लेयन बनेगा इस केस में वो फ्लैट मैक्यूल होगा. इस केस में थोड़ा एलिवेटेड होगा क्योंकि इस केस में मेलानोसाइट बहुत नीचे हैं, तो स्किन पे जो लेयन बनेगा वो ज़्यादा एलिवेटेड नोड्यूल टाइप होगा. ओके, एंड लेटर यू सी व्हाट हैपेंड. The cells are now not rounded anymore. With time, in the deeper layers, they turn like this. Like the vesicle. Aren't they looking like a nerve vesicle? Okay, this is called neurotization of the melanocytes. This is called neurotization, when these round cells turn into this shape, looking more like a nerve vesicle. This stage is called neurotization. And one thing I have to show you in this picture. Can you see the cells which are more superficial? They are more round and they are more in the form of nest and little larger, and the cells which are at the lowest part, they are small. You can see this is large cell. This is very much small as compared to this. This is larger one, this is smaller one. The cells which are at the top are little larger and they are small at the bottom. Okay, now let me take you here. That nevus cells which are superficial, they were larger. Okay, they were larger, you agree, and they produce lots of melanin and they grow in nest. And the ones which were in the deeper layer, they were smaller and they produce little or no melanin, and they do not grow in nest. They grow in coats, or they were like single cells. You can see they are like single cells. Okay, and they are growing in the nest. They are single cells. This is the difference between the cells in the superficial layer and the deeper layer. And at the deepest extent, these cells acquire fusiform contour. They have lost their circular round shape. They are now have acquired fusiform contour and they are growing in vesicles and they are resembling the neural tissue. Therefore, this conversion of these round cells into this vesicle type shape is called neurotization. Okay, and this is why is this happening? This is due to progressive loss of a particular enzyme activity, loss of tyrosinase activity and acquisition of cholinesterase activity in the deeper nerve-like nervous cells. ठीक है, एक्चुअली जो टायरोसिनेस एक्टिविटी है वो लॉस हो जाती है और कोलिनेस्ट्रेस एक्टिविटी एंजाइम की बढ़ जाती है डीपर नर्व लाइक सेल्स में, नर्व लाइक नेव. सो बेटा, ड्यू टू द लॉस ऑफ दिस टायरोसिनेस एक्टिविटी and acquisition of cholinesterase activity in the deeper nerve-like nervous cells, you can see due to the loss of tyrosinase activity and gain of cholinesterase activity, what change have occurred? The cells from this shape, they have turned into this vesicle-like, nerve vesicle-like shape. Okay, this is called, by the way, neurotization, and this occurred due to loss of tyrosinase activity in these cells and gain of cholinesterase activity. Okay, and one last thing about this is that these melanocytic nevi, they are confused with other skin conditions, mostly melanoma. Okay, this is all about today's lecture, where I covered three things. Beta, one is freckles, and number two thing which I did cover is um yeah, lentigo, and at number three I did is melanocytic nevus. Okay, if you have any question regarding this, you may ask me anytime, anywhere. Okay, if you really liked this lecture and helped you, you can subscribe to my channel. Thank you very much. Class dismissed.